being a hip surgeon is fantastic. I love everything about it, particularly doing the surgery. Even better though is seeing the fruits of my labour. I did a clinic the other week where I saw several patients who'd come for their 1-year checkup. They were delighted with the results, happily getting on with their lives again, free of pain. One of them even gave me a couple of bottles of wine, which is very nice. What happens though when things aren't quite right? No surgeon can make all of his or her patients happy all the time. That's not how life works, is it? We all have patients who aren't happy with their new hip. So how do we manage these problems together, you and me? Well, if you're my patient, this is what I do. Other surgeons might have a different approach, but most of us have had the same sort of professional training, so there shouldn't be too many surprises. I'll ask you to describe your symptoms, particularly about pain, discomfort, or a sensation that the hip replacement doesn't feel quite right. When did the symptoms start? What things make them worse or better? Is it getting better or is it getting worse? Are there any other symptoms such as a fever or a chill? I'll examine you very carefully, looking for signs of complications such as infection, nerve problems, or a leg length difference. Sometimes it could be your back or your knee that's causing pain. Quite often the muscles around the hip are tender and painful. I look at all of these things, gathering information and thinking about the things that might be wrong. We'll order some tests such as X-rays, CT scans, MRI and blood tests. These will show if there's any evidence of loosening of the hip components or if there's an infection or even a fracture. Most of the time there's nothing serious going on. The commonest causes of something not feeling quite right are often due to changes in posture and movement after you've had surgery. Your muscles might be a bit tight, causing your back to play up. In these cases, I'll usually recommend that you have a course of physio. This usually does the trick for most people. Sometimes I'll arrange for you to have an ultrasound scan to look at the gluteal muscles at the top of the thigh. These can sometimes become quite inflamed and tense, causing pain in the buttock and the thigh, often down to the knee. This is usually fixed by an injection of local anaesthetic and steroid, and it does wonders in these cases. But getting over surgery can take a year to 18 months for most people, so you have to be patient and persistent. I'll guide you through this, and I'll keep a very close eye on you. We'll talk about lifestyle factors such as losing weight, good nutrition and diet, and taking appropriate exercise. All of these things are really important. In a small number of cases, though, things don't settle down. Subtle problems like loosening, allergies and infections can sometimes take several years to become obvious. Most experienced hip surgeons are very much tuned into the warning signs of more serious problems and will keep you under regular review, ordering blood tests, X-rays and scans regularly to look at changes over time. Surgeons hate complications. Some of them aren't very good at dealing with them, especially when they know that it might be due to a technical error. We are only human after all. But what happens if you're not happy with your surgeon's advice? The best thing to do in this situation is to get a second opinion. If I'm not sure about the diagnosis, I'll often ask a trusted colleague to have a look at you, just to make sure that I'm not missing anything. If you feel you're not getting anywhere with your surgeon, then it's likely you've probably lost faith in them, and it's probably best to see somebody else. Remember though that each person's experience with a hip replacement is unique, and the best course of action will depend on your individual circumstances. Always consult with a healthcare professional for a personalised advice and treatment plan. Well, I hope you found this interesting and useful. If you've got any questions or any concerns about your hip, then please get in touch. The details are in the description below. Thanks for watching, and I'll see you next time.